First, for your health tonight, the Centers for Disease Control has confirmed 2 cases of Enterovirus D68 here in Spokane. The 2 children were hospitalized last month and have since been released. KXLY4's John Hendricks working for you tonight on the symptoms and why the Spokane Regional Health District says there is likely no threat to you or your children. John?
Aaron, good evening. Towards the latter part of September and the first part of October, the Health District says that they saw 32 kids who were hospitalized with symptoms of enterovirus. Of them, 2 of those kids were tested positive for the virus. Now, the Health District wants you to know that we may have seen a peak with the nationwide outbreak, but they still want you to be on the lookout for some of those symptoms.
The CDC says over the past few months they've seen more than 1,000 confirmed cases of enterovirus in 47 states, 2 of which were right here in Spokane.
We're seeing a decline in enterovirus activity. I think one state still has some increasing activity, but for the most part, it's a decline.
Epidemiologist Mark Springer with the Spokane Regional Health District says the best way to protect yourself and your kids from the virus is by washing your hands frequently, covering your cough or sneezes, and if you feel sick, stay home. Enterovirus D68 has similar symptoms to the common cold: runny nose, sneezing, and a cough. But there's one thing to watch out for.
The main thing that we wanted to have parents focus on was difficulty breathing or shortness of breath.
The Health District says enterovirus generally doesn't pose a great risk to the community. Springer says in the next few weeks and months we should see the number of suspected cases drop.
We're toning down in terms of what we see with enterovirus. We're starting to ramp up in terms of what we see with flu.
The silver lining to the enterovirus scare: an earlier than normal reminder to wash our hands regularly to prevent getting the flu.
Enterovirus was a good opportunity for us to start thinking about respiratory etiquette early. This is something that we should have in place, throughout the year, but especially in flu season.
Are washing your hands, you want to make sure that you're using warm water and soap, and you want to wash your hands for at least 20 seconds. The Health District told me today that oftentimes hand sanitizers aren't enough to do the job. Reporting live from the Sky Deck tonight, John Hendricks, KXLY4 News.